Hi, this is Becky from More Than Borderline, and today I'm talking about taking self-inventory of your likelihood to relapse. There's a lot of overlap between borderline personality disorder and substance abuse, and borderline personality disorder and self-injury, which can also be an addiction. So what are the signs you're likely to relapse? The first is exhaustion. Don't overdo it. You are more likely to relapse if you're hungry, angry, lonely, or tired. The HALT principle. 2. Dishonesty. Telling unnecessary little lies to those you care about. 3. Impatience. Slow down. If things can't happen fast enough, you'll be coping with your feelings by wanting something now, wanting that quick fix of addiction. Number 4, argumentativeness, especially over self-harm or drinking or drugs. If you believe that you have to be right and everyone must agree with you, you're setting yourself up for disappointment and a likelihood to use to cope with that disappointment. Number 5 is depression. That usually comes in cycles. As long as you know how to deal with it, you should be okay. The important thing to do is talk about it and take action. Talk to your counselor or a sponsor, and go to groups. Number 6 is frustration, if things are not going your way. 7 is self-pity. My therapist told me this frequently occurs around the 6 months of sobriety. Number 8, is cockiness. If you go into situations that wear down your defenses against that first drink or hit or cut, you're asking for trouble. If you think it can't happen to you, reality check, it can. Number 9 is complacency. This happens when it's no longer a conscious thought to stay sober or not drink or use, or not cut. A little fear is a good thing. Relapse can occur when things are going well because it catches us off guard. Addictions are cunning, baffling, and powerful. Number 10, expectations. I've changed, why hasn't everybody else? People do not do what they think we should. Live and let live. Don't set yourself up for disappointment by expecting somebody else to meet an unrealistic standard. Number 11 is letting up on daily disciplines. When things that are important to you, such as prayer, meditation, or reading a religious text, when those things are no longer important, that's a sign your priorities are getting out of order. Number 12 is setting unrealistic goals. If you want too much too quickly, or if you don't have what you want or don't want what you have, that's a likelihood to relapse. First things first, how important is it? Will this matter 6 months from now? Number 13 is forgetting gratitude. Life is better, clean, sober, and safe. Keep it simple. And number 14 is omnipotence, or thinking you know all the answers. You don't. So those are some behaviors and attitudes that can cause you to relapse. It's a good idea to take note of these things occasionally to determine where you are and outsmart your addiction.